Hello, this is Kabina Crawford from RMIT's Mental Health Program, speaking to the wonderful Paul Healey from HACSU. Before we get started, I'm going to do a quick acknowledgement. So I would like to acknowledge that we are on the unceded lands of the Wurundjeri, Woiwurrung and Boonwurrung people of the Eastern Kulin Nations. I'd like to pay my respects to elders past and present, acknowledge that always was and always will be Aboriginal land. Thank you for your time, Paul. How are you?
Good, thanks. Yep, it's a beautiful day.
It sure is, yeah. Well, for those of our students who have never had any exposure to unions before, do you want to explain a little bit about what unionism's about and what HACSU is in particular?
No worries. So, I'm Paul Healey. I'm the branch secretary. So I run the union on behalf of the members. I'm elected every 4 years by the rank and file members to run the union. So had our election 2 weeks ago. So I'm back for another 4 years, which is really exciting. I have a history of working in mental health. So I was a mental health nurse for 26 years and worked in inpatient units. And as a worker, I always thought that, work should be fair. We should be safe at work. We should get our pay and conditions looked after. And that we should also have the best facilities and services for the consumers and their families. And then I started to get really frustrated with when things were cut and things were changed, and started to get active in the workplace. And when the bosses wouldn't pay us properly, or we were unsafe, they wouldn't fix doors or chairs or whatever needed fixing, they wouldn't do. So I started to really arc up a bit as an activist. And then our delegate resigned, and they said, "Paul, you're good at arguing with people. Can you become a delegate?" So off I went and argued with the boss about some issues we had, and he'd been quite abusive and hostile towards the staff. And I went up there and asked him what sort of fella he was. Why would he be so rude to people who are just caring about the workplace and caring about, and this was at the Royal Children's, about their reputation and the well-being? Why would you yell at people? I don't understand. What sort of person are you? I may have asked him that 3 or 4 times. And he did ask me to be quiet and say, "What do you want? How can I get you out of my office?" And I said, "If you fix these things nicely, then I'll go away." And he said, "All right." So I went back down and said, "Well, I've asked him politely, they're going to fix it." So we got our issues fixed, and we ensured that the safety in the unit was really good. So unionism is about fairness, is about safety at work. It's also about making sure that we can make positive changes to the world. And a lot of the changes we see in our lives, which we'll take for granted, if you go back through the history of it, it started with the unions and things like superannuation, which for people new to it's a fantastic thing, super. As you're getting towards the later in your career, like I am, looking at your super fund grow is really exciting to look forward to having a good, safe retirement. But also things like Medicare, holiday leave. One of the campaigns we've worked on recently is reproductive health leave. So it was around menopause and menstrual leave, but we felt it needed to be broadened out. And so we worked on reproductive health because everyone has reproductive health issues over their journey in their lifestyle. And now we're in some agreements got 12 days reproductive health leave, which is when we started was the first in the world, they thought, by Sydney University. So it's things like that where you make real positive changes to people's lives is what unions are about.
That's amazing. Thank you so much for that. So unions, there's all different kinds of unions for all different kind of jobs, right? And what does your union cover in particular?
So our union focuses on workers in disability, mental health, some AOD, so alcohol and other drugs, and that's how it. So we're called a craft union. So it started out where that craft group, which was in the institutions in the day. So we commenced in 1911 and have been running, and we're the only specialist disability and mental health union in the country. So it is really a Victorian craft group, and we cover the Victorian area. And so we have about 13,500 members and 8,500 disability and 4,000 mental health. And so Victoria has maintained, it's the only state that has maintained the registration, the title registered mental health nurse in agreement, and the only specialist mental health agreement. So Victoria has a very strong identity in mental health, particularly because of the agreement. And our agreement in mental health covers allied health, so OT, social workers, and all the other groups. We've got nursing, admin, and also people with lived experience. So we've got the strongest lived experience EBA in the country. So in 2014, lived experience workers, those who have lived and lived experience or work of mental illness or have looked after people who have. the carers, the families. We've got an agreement for them, and it was the first in the country when we did it. And now we've built that up over the last 12 years to have a 7-level structure and all the good paying conditions and develop. So it's been a really good thing, and that's what unions do. It's about setting good wages and conditions, so you've got a working living conditions so you can keep growing. It's about maintaining the professional standards and that sort of thing to ensure that workers are prepared for work. And in disability, we've had the only specialist disability agreement. It was public sector. Now it's moved to the NDIS providers, and we're working in bargaining that to make sure we maintain those quality education, supervision, support for workers to maintain their careers, but also not to make sure they got the best possible wages and conditions we can wangle in the NDIS envelope.
That's amazing. So you're doing a lot of work in the background to make sure the sector is a better place to work for people who graduate from something like a Certificate 4 of mental health, yeah?
Absolutely, and we're always looking for ways to sustain people. There's such shortages of staff. I reckon every worker is so valuable, and we've got to try and make their workplaces and their careers and their jobs as good as possible to maintain them in there, because they can't replace them. And it's the skills and the passion that those people bring to the workplace that makes a difference. Both disability and mental health are labour intensive. There's nothing like you can't just give people a tablet and expect them to get better. It's the interpersonal relationship that you have with those people and their families that makes all the difference. When I was on the floor working, I used to say I was in the business of planting seeds. I don't know what's going to help people. I can think that this could help. I don't know, but I used to put out lots of different ideas and allow that person to pick the ideas they want to suit them. And sometimes you actually hit pay dirt and you come back and catch up with someone a couple of years later and they say, you said one day this, and that really changed me. That made a big difference for my life. And you go, oh, okay, wow. So it is a job where, you've got to really be engaged. And I used to try, and the simplest way, it's a bit frustrating at times, but the simplest way is I say, I've got to start with making everybody I meet's day better by 1 minute. And so everybody I met in the unit, so I worked on a unit with 16 people, 7 staff and all the other different people. So I'd make sure, and then you keep building those minutes up. Each time you make a better minute, and you just build strong relationships with people, and you can actually help them. And I always find that's how much we learn as well as people working in mental health and disability, how much you actually learn about yourself and about the world through the great and rich experiences you get from people with lived experience and their families.
Yeah, that's amazing. So you said you were a mental health nurse for 26 years.
Yes. Yeah, in those days when I trained, it was a direct entry, so you got employed by the hospital and trained at the hospital. So 1 week, on the Friday, I was on the dole, having a great old time living on the dole in $82 a week, which was a king's ransom in those days. And on the Monday, I started nursing. They gave me a white shirt and a pair of grey pants, and they said, off you go and start working, and let me loose on the wards. And then 6 months later, I started my training and then subsequently completed. But I've been able to, from the time of the big institutions to deinstitutionalisation to mainstreaming to seeing all the different changes. And so you've seen the progression and the changes. I think it's been very positive. But I also see there's some negatives that they haven't really fixed up, and that's the working community. We need more community staff, more funding for community teams. We need to develop hospital in the home stronger in mental health. We've only got 3 services with hospital in the home. We need more of that so people get treatment in the home. We also need to have more diversity of bed stock to ensure that there's the right bed at the right time for the person on their journey, rather than at the moment we have a one-size-fits-all adult acute unit mostly. And that's a real pressure cooker of people who are acutely unwell, because we don't have enough other beds for people to go into as they need it. And I think that people should be able to go into hospital when they're ready and choose what sort of bed they want, what sort of stream they want, and then do it. We haven't designed the system like that. We've been lobbying for it for a long time. When they had the Royal Commission into Mental Health, and every Royal Commission or Productivity Commission, the union goes up with plans and schemes and ideas about how to improve mental health. But we get these ideas by talking to our workers and members on the ground and talking to the consumers and their families. And then through that, we get these ideas, and then we put up what we think is the best possible mental health system, and then advocate for that. And then we continue to advocate, and we review our plans every year. And then we go around Parliament and talk to every single politician, as many different parties as we possibly can, to try and educate and bring up the knowledge in Parliament, the decision makers, to increase their knowledge so they know what to do. And so that hopefully we'll make some good decisions. So it's a bit of a long, slow game, but unless you dream and have a vision of where you want the world to go to, you can't expect it to get there unless someone's butchered it there. So that's one of the things that unions can do. We can say and do things that no one else can, and we could push for things that people aren't game to do. And also we push for things like drug law reform, because drug law reform, we see so many people with mental health disorders ending up in hospital with drug and alcohol issues as well. So how can we, and so that affects their outcomes for their mental health. So if we start improving the drug and alcohol system, that's going to help the mental health system. So I always say all parts of health are connected, and people, and anywhere the system fails, people end up in mental health. So if there's homelessness, they often end up in mental health. Drug and alcohol, they end up in mental health. Coming out of the justice system, they can end up in mental health. So all these systems. So we advocate for stronger reforms in prison. We advocate for stronger changes for homelessness. We advocate for drug and alcohol reforms. Pill testing, we worked on pill testing. The dispensing machines for naltrexone, because we just believe if you can save people's lives, work in people's lives, you can make a big difference. So they're the sorts of things unions do. We also work on things like peace, activism about peace. There's 107 wars in the world, and we're actively campaigning for peace. And when you think about in Palestine, in Lebanon, in the Ukraine, there's some of the big wars, but there's a number of wars in Africa, and we should be unions calling out, these things to say health workers are there getting killed, doing their job, keeping people safe. That's not right. Healthcare workers should be able to go anywhere in the world and help people in need without fear of themselves being targeted. So that's another thing we do. So there's lots of things like that the union actually do as well.
That's amazing. So it's not just about improving your workplaces and improving your pay and conditions, but it's also about creating a better sector and a better world.
Yeah, and absolutely. And unions have been leading the way on making a better world from the time unions started. It's all about making improving, and that advocacy and that strength and that it comes from the collective voice and being together and being supported. There's nothing better than being in a workplace where you all work together. You've got a common goal. And when you look across at that worker, they know they got your back, and having that support and knowing they got your back. And a lot of the hospital, places people work, the bosses do their best. And I'm not an anti-boss at all. They're doing the best, but they're constrained by funding, and so they'll make decisions based on funding or what they can do, and that may impinge on workers' safety and workers' rights. And that's where we come in and say, hey, that's not on. You've got to make sure this is a safe workplace, and you've got to pay the person the right wage. But at the same time, I will then go to government and say, you've got to fund the hospitals properly and the services properly, because they've got to run properly. And if they make cuts to services, we campaign against those cuts. If the building is too old and dysfunctional, we'll campaign about getting a new building built, and we'll go and campaign for that, because they're the things that can make positive changes. And we know when you're in a good, safe environment, staff feel really confident and strong. And when they feel good, when the staff feel good, it's going to be good outcomes for the consumers. And we kind of mirror each other. If people feel unsafe and anxious, it'll mirror off the staff and mirror off the consumers. So you can often judge where things are by looking at each group, what's going on. And when people are in a good, safe place and good therapeutic space, everyone feels good and everyone does well.
Amazing. So I'm going to ask you a couple of questions, because this is like in the first month of the course. So people have enrolled and they're very excited about working in the mental health sector. So I want to ask you about the good things about working in the mental health sector, then the not so good things, and then how they can work in their workplace to improve the not so good things. So what are the good things you have to look forward to when you're working in the mental health sector?
Look, I think the thing I loved about it is meeting the most amazing people ever. You will meet some people who are so much talent and so much skill and so interesting and so funny. Like, I remember being at work with one guy I knew. He was so funny that he made me laugh so much I felt sick. I had to hide from him at work because he just made me laugh too much. And enjoyment, the ability to make people in some of their most distressed times in their lives and the worst times in their life, you can be there to support them. and make big changes. It's whether you say something or don't say something, or you sit quietly with them, but to provide the comfort they need at the right time and to be there for them. And it's all about what that person needs, not what you think they need. And it's about getting those skills. It's also, when you're working, you've got to be patient with yourself. It takes a long time to develop really strong skills in mental health. They used to say post-graduation, it took 5 years to really be a fully fledged clinician or a worker. So I always say be patient with yourself. It's going to be hard. You're going to be confronted, but you need to be really kind to yourself and get support when you need it. And so I really found the joy of the people. I found it interesting. It's different every day. People are different every day. There's an amazing amount of different disorders in mental health. And I worked in adolescent psychiatry, so I didn't know whether I was getting a childhood disorder, an adult disorder emerging, or was just adolescents. They've just been cheeky adolescents. And so I found it fascinating trying to pull all the bits of puzzles together to see what was actually going on for a person. And I just was amazing that, you can make such good positive changes to people's life. I always said, if I could change a person's life by 1 degree over their life, that's a big thing you do over a lifetime. I always believe you treat everyone the way you want to be treated. So, and that's really important. So sometimes it's frustrating and annoying, but if I felt frustrated and annoyed, I'd say I feel frustrated. I always use me as the example. I always talked about how I felt, because that's what I know about. And it's really important to understand how you feel about things. And if you feel shocked, you say, oh, that's shocked. I find, so you've got to really understand that. And if you don't feel comfortable, you say, I don't feel comfortable, and you walk away. Or you feel something's really positive, you go, that's fantastic. So it's really about using yourself as a therapeutic tool to understand and support people. And if someone says something that's not nice, you go, well, that's not nice, I don't like that. Or one of my colleagues here just goes, that's rude. So that really is a really direct way to say, I don't think that's right. And the golden rule, when in doubt, escalate upwards. That's my golden rule to everything in mental health, is always, if you're in doubt, say escalate it. And that's the best thing. And always to be humble about you don't know everything, and that there's experts. So I used to love, one of my favourite things was, if I might know a bit about social work, something in social work, I would say to the consumer, I know this much. Let's go and talk to an expert. And I'd take them over and introduce them to the social worker, and then work with the social worker. And then you had a bond with that person because you're both learning together. And to be on that level with someone, always keep your boundaries, always keep things strong, but to really be on that level and work with someone is really exciting. And to see positive changes in people's lives. And it's a slow journey. It's their journey, not yours. So it might be a millimetre here, a millimetre there, but that's their journey. But to see improvements is really good. And to see some people just turn their whole lives around and thrive, it's just amazing. The other thing is, I'm always amazed by people how resilient humans are. Humans are amazing, resilient people. And what they can live and go through and still be amazing people just never ceases to amaze me. And I'm always impressed by how people could bounce back from just about anything and keep going. One of the things I always thought was, I could never change the past. I could listen to people's past, but I can't change it. I can only help them going forward. So while I always acknowledge the past and the pain people felt and listen to that, I said, I can only help you move forward. And so I used to try and always work moving forward and to problem solve going forward. How can we fix things going forward? And that always gave me somewhere to work with someone, because if you get stuck trying to change the past, I can't do it. I don't have a magic time machine or anything, but I always could make their day better by looking at what we can do forward. And that's something I always focused on. And that seemed to resonate well with people, and, sometimes people don't always like you, but that's okay.
So that's a good pivot into what are some of the challenges that graduates are going to face? So they've got their certificate 4, they're going out into the workforce. What are some of the challenges they're likely to face?
Well, one of my favourites is that if you're self-conscious about anything about yourself, a consumer will pick up on it and mock you about it, or tease you about it, or wind you up about it. So you've got to be able to laugh at yourself, because, like, oh, I'm going bald. They say I was a baldy head, or or I got a big nose, or if I had a pimple on my face and I was self-conscious, oh, you got a big, someone would pick it out and say something about it. But that's okay. You learn to deal with that, and that's it's very demanding. It's emotionally draining. It's very tiring work. So I always think you've got to look after yourself, both physically. So you've got to be aware, sleep is really important, exercise, good diet, drink, all those things we talk about. But when you're working in mental health, you've got to have good, healthy mental health yourself. And so it's really important you focus on that. And so, you don't have too many parties during the week when you're working, or get to bed early. And you've got to have outlets. You've got to have outlets where you can actually decompress from your work. You will take home traumas, the things that will really distress you, and that's okay, but you've got to understand those traumas. And what you've got to do is find a supervisor or support or whatever you need to actually get through those and work through them and understanding. And once you understand, and oftentimes once you understand what distresses you and how it distresses you, then you can use that to actually help work with the person. So it's not the problem, it's what you, I always say, it's not the problem, it's what you do with problems. So if you feel like something's a problem, it's what you do with it. You can always turn it around into a positive. So if you're distressed by something, imagine how they feel. So it's about how you work with that. So one of the things that the union does offer, and this is an outrageous ad hit right here, is that we have Hunter Link, which is an EAP service, so an employee assistance program. It's free with your union membership, and you can get 3 EAP sessions anytime you want. And also it has a 24-hour helpline where you can ring a counsellor for you or your family, so when you have a bad shift and you come off and you feel like you've got no one to talk to, and you don't want to unload to your family because it might cause them distress or whatever, you can ring this helpline 24 hours a day and they'll get back to you and talk to you through it. I wished I had it when I was working, because I had some bad shifts and I was a shift leader, so I'd get everyone sorted out, get all the things done, but I didn't really have anyone I could talk to on an evening shift about how I felt. I often used to come home and talk to my family, and that caused them a bit of distress. But if I'd had that helpline to ring up and say, look, I've just had a bad shift, and get all that off my chest before I got home, it'd be huge. So, and we always want people to get in early. What happens, mental health workers are very bad at looking after themselves. They tend to hold on to stuff. And then when they start to unravel a bit, then they seek help. What this is about is get in early and get in often and get it sorted out so that we maintain your career. And that's the focus of this, is maintaining your career and keeping you there. And it is about, keeping people working. So it can be emotionally draining, physically draining. I remember plenty of times just knocking off shift and going home and just falling on the bed and going to sleep. Because I'm just so physically tired from walking around, doing stuff, up and active all day. So it is about that sort of side of it. It's complex. You'll meet a lot of complex issues, a lot of social, emotional, complex issues. You'll be challenged about your thoughts and beliefs, and you have to sometimes park what you think and just sit with the discomfort and listen to other people's beliefs. But it's also good because it also gives you a much broader and expansive view of the world. So I think that's a really exciting part of the job, but it's also quite challenging at times to carry that. Sometimes it's also the trauma that consumers do carry. Sometimes it's hard to sit with that and hear those stories. So that's I think. Also aggression. So there is physical aggression and verbal abuse, and how you deal with that, and so hopefully your workplace has good, strong, safe systems. And if it doesn't, call the union or get OHS in, because you've got a right to be safe. You've got a right to come home in the same condition you go to work in. So that right is an absolute. That's the boss's job, to keep you safe and to keep you going home in the same condition you arrived. So you need to make sure that if it's not right and not safe, that you always first rule is withdraw yourself, keep yourself safe, and then work out what to do. But always your own safety first, and then others after that. And that's really important, because if you're not there to do the work, there's no one else to replace you. So, and I had lots of different adventures during my time in mental health. But the thing is, if you've got a good, well-organised workplace, a good unionised workplace, good OHS, good HSR, health and safety reps, you are more likely to have a safer workplace than not. And that's what builds good, safe workplaces. And then you build a good, strong culture. And if safety is the culture, then compromiseness doesn't happen. And so you just got to make sure you work in a place and get the collective together and make sure you just expect safety. I get a bit frustrated when I go to a workplace and there's a door that's broken, and it might be to the intensive care area or something. And I say, how long has that door been broken? And they've got a chair propped up against it to hold it shut. Oh, 6 weeks. Why? Is that safe? No. Well, why haven't you got it fixed? I don't know. Oh, I don't know. It's not fixed. Well, you need to get your HSR. Where's your HSR? Over there. All right. Get them to inform the boss that that door's not safe. And if they don't get it repaired, you're going to pin it. Check back the next
So a
day.
health and safety representative is an HSR and a PIN is a provisional improvement notice, right?
That's it. That's the language. Even though we use all these acronyms, that's the real language.
Yeah.
And they went and spoke to the bosses and said, we need this door fixed. And if you don't fix it, I'll give you 2 days. If there's no plan, I'm going to put a PIN, provisional improvement notice, and lo and behold, it was fixed. So after 6 weeks of putting up with it, it was fixed in 2 days. And that's the sort of things, you know, if you see something's wrong, call it out. Use those mechanisms that you got to keep the workplace safe, and that's good.
Amazing. So I'm just thinking a lot of our graduates go into entry-level positions and a lot of them are with some dodgy NDIS providers. So you might have students graduating into a workplace where there's not a lot of union members, not a lot of union density, and they might be put in situations where their safety is at risk. So how would they go about protecting themselves in a way that ensures that they're not going to be disadvantaged by their activism in the workplace?
Well, the easiest way is to build more numbers, and the more numbers is, the better it is, the stronger you are. But each person's got a right to advocate for themselves. So it is about, you know, anything that's a problem, the key to it is to write it up. So write out what the issue is, report it to your manager, report it to your supervisor, keep it diarised, keep everything diarised. So make sure you put notes in your phone. On this day, I felt unsafe here because of these reasons. You can contact the union. So when we get these stories, sometimes we can't just go into a workplace, or we can sometimes go to workplace and change things. We can use our powers. And other times what we do is we take the stories and use them to advocate for better systems. So we will go and meet with the Minister for the NDIS, Minister Butler, when we get the opportunity every now and then, and say, these are the stories we're hearing. Or we will go to WorkSafe and say, these are the stories we're hearing. Or we'll go to Trades Hall and get them to hear the stories as well. So we will tell the stories. And the best thing about things, or we'll go to the media, if there's a really big issue, we'll go to the media and cause a real brouhaha and say, it's not on. And we can embarrass them, and we can go to the manager. And sometimes if the managers don't know there's a problem, they might not know, but having the union ring up and ask questions sometimes is good enough to get things fixed too. And really doing that. But it's also about, it's not accepting it, not putting yourself in risk. There's lots of good employees, so lots of good jobs out there, and that's a good thing for you. It's a buyer's market, as we say, and there's plenty of fantastic jobs, and don't work for dodgy employers. Find a good one that's really committed to looking after their workforce. Like I just, today was a good day for us. Uralla, who's a disability provider, had underpaid their workers. Our members notified them. They checked it out, and they've back paid them $2.1 million for 1,300 workers. And they didn't. It was fantastic. But they've done the right thing, and so there's good employers like that do the right thing. So it's important to find that and to work with them. And if you're ever in doubt, if you ring the union, and the union can support and point you in the right direction. There's nothing worse than when you feel so isolated. And I have been accused, I used to work sometimes on the floor and think nobody cared about me. And I used to say, who the F cares about me? And then I thought, oh, the union does. And that's all right. Then I'll ring them and talk to them. And, they'll give advice and point me in the right direction. Oftentimes there's EBAs or agreements that you can use to say, hang on, I'm meant to have, I'm not meant to work 12 hours straight without a break. I'm meant to have X amount of breaks. Or I'm not allowed to, after 5 hours, I'm entitled to half an hour off. Where's that? And things like that. So you can use the EBA. So I always say this, you can use the EBA. You can, and for safety, it's the OHS regulations, or you can ask politely. There's 3 ways to do many things. So they're the 3 ways that you got some powers to do things. Polite, OHS and the union can get things changed. And sometimes we use them all at once.
Amazing. So your advice would be always keep written records of everything, any safety concern you have in the workplace, get onto the union for advice as soon as possible. What kind of occupational health and safety, what kind of injuries and risks and hazards are you most likely to see in the industry?
Look, it's at the moment, there's a large percentage of psychosocial. So people, it's that wearing down, that sort of stress, bullying, harassment sort of thing, occupational violence, those sorts of things, traumas. You see a fair bit of that. There's also the physical injuries, so people have been assaulted or have falls or helping people up, injuries, those sort of back injuries as well. They're the main ones, but also people get injured. There's all sorts of things. You're traveling to places, you get injured on the way to work or accidents. And so there's all sorts of things happen to people, but it's really about ensuring that if you do, you write it up. If you injure yourself at work, it doesn't matter how big or how small, always put it in and notify, because if it could happen, it could get worse. It could be a lifelong injury and you haven't done it properly. And I know this because I hyperextended my knee one day at work and just went home, put a bag of ice on it, and then thought it was all good, and then got a little bit of treatment, and then I just left it and didn't follow it up properly, and now I've got a bung knee, but there's no evidence that I ever did it at work. And so you've got to make sure if you do it, you do keep a good record of what's happened, so that if there's ongoing injuries, that you can pursue them and sort it out. So yeah.
Excellent. So make sure you use the systems that there are laws to ensure that employers have systems in place to keep people safe.
Yep.
So make sure you educate yourself about the systems, and make sure you record everything, because it can prevent future injuries, and also it can show a pattern. If there's a problem with the culture of the workplace or with the practices in the workplace, having a record of that is really useful. And if you are daunted by this, do you recommend people call HACSU and
absolutely
and have a yarn?
So you've got us, you've got the union. If you're a union member, they're absolutely 100% here to support and help you. We've got a phone line here that you can do. We've also got an incident issue thing you can report in. So you just do a text, just text it in, and we'll come and talk to you. We'll ring you up and check how you're going, what's going on with that. So that's one way. There's also Trades Hall's fantastic with the Young Worker Centre, so that if you need, as a young worker, you need advice, you're under 35, they're there as well. So there's all these mechanisms that there is to support and ensure that workers are well cared for and safe.
Absolutely. So it's definitely worth the investment to sign up. Like there's all kinds of benefits in terms of working for a more socially just world, working for a more socially just sector, but there's also really practical benefits to union membership as well. Yeah. So if people, because psychosocial injuries and seem to be the big problem in the industry.
Yep.
We've got a speaker on psychosocial laws, psychosocial hazard laws from Trades Hall, who's going to be speaking about how to put provisional improvement notices and all that sort of stuff in. But we've got about 4 minutes to go. So what do you think students need to know about the industry before they start their first job?
Look, I think it's a fantastic job. You're going into a fantastic career. It's full of opportunities. It's something you can go everywhere. The skills you learn, the things you do, could take you anywhere, and it can actually support. And it's an amazing thing. It's an amazing job to help people. The outcomes that you bring to people's lives is so positive and so dynamic. But also you'll find yourself in a great career, and you'll meet some great colleagues, and they not only are they often very funny, but you make friends for life. And to be a part of a system that's working for positive things, for positive change, to positive outcomes, is a great system to be in. It can be, as I said, a brutal system, but there's more of us than them. And I always say the workers, if we all stick together, we'll take over the world. And that taking over the world we do slowly these days. There's no revolutions. But the thing is, as a collective, we can all stick together, keep everyone safe, and ensure that consumers and their families are getting the best possible lives, and hold governments to account, and bring in things like the NDIS. That's a Labor workforce reform. We can bring these things, but then hold them to account to make sure it runs properly. We go to the minister and rattle him and say, this is not good enough. And we'll campaign and to continue to campaign to make strong systems, so the benefits of those who can't talk for themselves. And sometimes the only voice they have is you. And that advocacy and those skills that you bring are so important to making their life that much better. So I commend you. I hope you enjoy it. I enjoyed it thoroughly. I still miss it. It's great working for the union, but it was great working in mental health, and I hope you really embrace it. And we're always here if you need us, and always look after yourself and always seek help. I always say people are mental health workers are good at giving advice, but are terrible at taking it. So you've got to learn to take advice as well as give it.
Excellent. Well, that's excellent advice. Thank you very much for your time, Paul. We've learned all about what people can expect in the sector, a bit about OHS, a bit about the broader benefits of union membership, and we really appreciate your time. It's great to see such a passionate advocate in there fighting to change the system. So thanks for your time.
No worries. Cheers. Bye.
Cheers. All right, I'll just stop the recording.